Alrighty, good afternoon. This is my final presentation for lifespans. I figured I would just read each question and just give my answers. Number one, compare and contrast probable and appropriate functional goals and expectations from a physical therapist perspective for the developmental stages from school age to late adults. Starting with the middle childhood, which is 6 to 12 years about. This age group is rapidly going through a lot of changes and development in all aspects of their mind and body. It is important for this age group to be as active as much as possible through play, running, jumping, kicking a ball, playing in the sand, and exploring the world is going to help them develop their coordination, strength, flexibility, proprioceptive acuity, memory, and cognitive abilities. During this stage, I would expect a child to learn to relate past and present memories to reason, improve their focus as they age, be able to plan out actions like first I do this, and then I do this, and then I do this. Their memory strategies should improve as they reach age 12. Complex tasks such as reading, writing, doing math should begin and improve along the way. Spatial reasoning should improve. Concepts of time should improve. Beginning to form mental images as they read. Playing sports, understanding rules of games, and being responsible for homework, simple household chores, and developing friendships among peers, as well as gaining ability to regulate their emotions. For adolescents, which is about 12 years old to 20, this age group is also going through a lot of physical and mental changes and cognitive changes. A little bit slower than the middle childhood, I would say, but they are transitioning from childhood to adulthood, which makes their situation very different from childhood, the middle childhood. Their brain is becoming more complex, especially in their prefrontal cortex, which is going to affect their decision making, their impulse control, and their abstract reasoning. Due to this, they are able to learn faster than some of the older groups, but they are also more prone to risk taking. They have a harder time understanding the concept of mortality and long-term consequences to actions, such as smoking, jumping off a bridge into a lake, drinking and driving, and all of that stuff. This age group, I would expect to be able to think abstractly and scientifically, become good at certain fine motor skills depending on practice. For example, playing the piano or playing a sport, they're going to have to practice that to be good at it. They're going to focus more on relevant information. They're going to have an increased knowledge and processing capacity compared to middle childhood. They're also going to begin being able to metacognition, which improves their problem solving abilities, being able to look, think about how they're thinking and approaching problems, which is huge for their problem solving capabilities. This age group is also learning to drive. They might have a job. They might begin developing romantic relationships, playing competitive sports, and then also being responsible for household chores, yard chores, things like that. Cooking and shopping independently. And they're also going to be independent in their schoolwork as well. For early adult, we're talking 18 to 40 years old here. This age group is becoming independent from their parents for the first time. They're finding partners, creating families, becoming economically independent, completing their education, starting their careers. During this stage, a person will reach, speaking physically here, they're going to reach their max bone and muscle density. Exercise becomes important to maintain their cardiovascular health. Certain physical characteristics may begin to decline depending on their person, hearing, vision, cardiovascular endurance. But cognitively, this stage is the most developed. This stage begins to have a lot of begin to have a lot of functional expectations as well. Many people in this stage are juggling kids, maybe their parents, depending on how old their parents are. Um, this stage, I would expect to have an expert level of acquisition of knowledge. They should be really good at learning things. Form new and meaningful questions to solve problems. They're developing their career, developing long-term friendships and personal identity. They're working, they're driving, they're being contributing members of society, and they should be independent in pretty much all ADLs. Middle adulthood, this is 40 to 65. This stage in life, people are beginning to show physical signs of aging, wrinkles, gray hair, stuff like that. Vision, strength, aerobic capacity, their max heart rate, and reaction times are going to begin to decline. But intellectual capacity remains high if they're using and challenging their brain. The phrase use it or lose it is big for this stage. Exercise and challenging themselves physically and mentally can help reduce loss of a lot of physical and mental aspects. These people don't have to, be the quintessential old, little person. If they're taking care of themselves, they're going to be able to move almost as well as they did in the previous stage. Adapting to physical changes is extremely important to keeping people in this stage healthy and happy. Exercise, stress management skills, and having an optimistic outlook goes a long way to keep people from declining rapidly. This stage, I would expect them to be forming hobbies outside of work, outside of being a parent, preparing for retirement and career changes. These people will more than likely be caring for their parents, preparing for the death of their parents, mentors, things around them like that. And then older adults, this is 65 plus. This stage begins to have less responsibility, authority, and economic constraints or responsibilities, but they also have less money. Leisure time may be filled with community, volunteer work, hobbies. They're also dealing with health concerns and preparing for death of their spouse and friends. They may be facing ageism issues as well. Physical, sensory, cognitive decline is happening. This stage, I would expect them to be using assistive devices to help with IADLs and BADLs. They should be modifying their home for safety, practicing energy conservation techniques, practicing self-care routines, maintaining social relationships, and focusing on what they can control rather than what they cannot. That's going to be key to helping them continue to have a positive outlook on life. Moving on to number 2, compare and contrast learning techniques and strategies to be utilized by PTs and PTAs when working with each developmental stage from school age to late adults. Starting with the middle child, there are a few strategies to keeping this age group engaged and compliant with the program that you give them. Number 1, giving a lot of encouragement and praise is key. Kids this age need to feel successful in order to be confident. Number 2, making sessions fun, such as turning it into a game, will make it seem less like they have to do something and more like they get to go do something. Having a reward system like a star chart or something to help motivate the children to do at-home exercises will be beneficial. It is important to keep instructions simple and make sure that any task that you give them is challenging, but it is something they can definitely do. And then lastly, working with the parents to continue the positive outlook and, reward system implemented will be huge just for consistency's sake. For adolescents, this age group, they're really finding themselves and their identity. They're coming out of childhood into adulthood. So they definitely want to feel like they have body autonomy. They can be very self-conscious and easily embarrassed. So with this in mind, the best way to teach and work with this age group is to, number 1, talk to the teen about their treatment rather than talking about them or around them to their parent. This will give them a sense that they're not being talked down to and feel more involved with their treatment. Because this age group is transitioning from childhood to adulthood, they want to feel like they're being treated like an adult and not a child. Also being mindful of anything that could embarrass them, like teasing them about a boy or how they dress or something like that. They can be very easily embarrassed, and that might not be very fun for them. Early adulthood, I think with the early adult, middle adult, older adult, it's important to find what is going to motivate them, to keep them motivated to do the exercises. So early adult, these people are focused on finishing schools, growing their careers, and creating families. They're not going to probably be as concerned about long-term health as much as what they have going on in the here and now. In order to motivate them, I would be talking to them about the importance of keeping up with rehab and sticking to the program in order to get back into doing whatever it is they love: hiking, jujitsu, running, playing soccer, whatever it is that they love. The middle adults, they're juggling taking care of kids as well as their parents. They are also beginning to see declines in certain physical aspects as well. They're going to be more likely to look into the future and how they can be as healthy as possible for as long as possible. And then older adults, they're at a time of life where they have fewer obligations, less freedom, less money. They're declining physically and mentally and have more safety concerns than they did before. To foster learning with this group, they need to feel like they can trust you. Treating them with dignity and respect and not talking to them like a child is key. Clearly explaining why each task is important and relating it to the functional goals they value. Allowing them to process at their own pace. Give them tasks that they feel they can achieve. Each person may have different preferred learning styles as well. Seeing an exercise demonstrated, verbal instructions. Maybe they don't want a lot of over-explaining. Maybe they're more of an intuitive learner. So talking to them about how they like to learn and tailoring that to them is going to be ideal. Number 3, compare and contrast discharge concerns from a physical therapy perspective of the developmental stages from school age to late adults. So with the middle childhood, things to consider are whether the child will need additional care from home, occupational therapy, or outpatient physical therapy. If the child will need assistive devices to navigate their normal life safely. Whether it's appropriate for the child to return home after leaving the hospital, or do they need to go to a rehab facility. Also considering which parents or who involved in the child's life needs to have at-home education, what to do with the child, what medications they're on, the schedule, stuff like that. And then education on medications, rehab, care for the child, for anyone involved in the child's life. For adolescents, much of this may be the same as the middle child, but older adolescents may be more responsible for their own care. At-home rehab exercises and use of assistive devices may fall under their own responsibility rather than having a parent doing all these things for them. Medication should still be monitored by a parent, and parents need to be educated on post-care, but the child should also be involved in that. And they need to feel a part of decision-making and feel in control of their health as much as is reasonable. Young adults and middle adults I lump together here because I feel like they're kind of similar. Patient education is important as always. Where are they going to go when they leave the hospital? Young adults may be more likely to return home directly than older adults, just because younger adults are going to heal faster. Middle adults will likely need longer to rebuild strength and flexibility, or whatever functional movements they need to go home and do ADLs as independently as possible. They also may need more assistive devices than younger adults. Middle adults may also have their parents that they care for, so they may need to arrange help taking care of all of their responsibilities while they're recovering. For older adults, older adults have all of the considerations of the younger age groups, as well as factoring in their mental state is huge. I mean, mental health for all ages is important, but older adults can very rapidly decline if they are not in a good situation. Prolonged hospital stay can lead to rapid decline in mental, physical, and emotional state of the patient, which in turn makes it harder for them to recover. This is why mortality of hip fracture patients are so high. Arranging friends and neighbors to help them when they return home may be helpful, not only because it's safer, but also it may raise their spirits to have people they love around them. Adjusting the home environment is going to be important, and making sure it is as safe as possible. Adjustments at home may include removing anything they may be able to trip over, like rugs or wires in the walkways, installing night lights in low light areas, installing grab bars and railings in the bathrooms, and non-slip rugs in the bathrooms, anything like that, just so that they are as safe as possible. The last thing you want an older adult to do is fall when they're trying to recover from something else. So number 4, compare and contrast risk factors and safety issues of school age to late adults. For the middle child, their safety concerns are going to be that they are still clumsy and unaware of dangerous situations, especially, on the younger side of the middle childhood. So they are going to be more accident prone. Also, physically, their bones are not fully formed and strong yet. They're still a little bit flexible. So they're going to be at a higher risk for green stick fractures and avulsion fractures. So you do have to be careful with, playing sports or, falling out of a tree or anything like that. Even just overstretching if the child isn't particularly flexible can cause issues. For the adolescents, they're also still at risk for like avulsion fractures and stress fractures if they play a lot of sports, but they're really prone to risk-taking behaviors, which makes them more accident-prone as well. Risk-taking activities such as smoking, alcohol consumption, experimenting with drugs is more likely in this group. Like I was talking about earlier, their prefrontal cortex is still developing, and they just have a higher drive for that sort of thing. Also, suicide is the 3rd leading cause of death in this age group. So that is also definitely something that you want to keep open, your mind open about whenever you're dealing with kids like this, so you can catch something. If they're showing signs of this, you want to pick up on it. For young adults, the most common causes of death is going to be homicide, car crash, also suicide. Risk factors for this age group are largely modifiable. People in this age group may not yet be concerned with mortality and long-term effects of their lifestyle choices. Long-term, this can lead to issues like hypertension, atherosclerosis, diabetes. The risk factors for this age group are going to be smoking, obesity, sedentary lifestyle, poor nutrition, substance abuse, and also lower socioeconomic status, lack of health insurance. Those are all big things for the young adult. For the middle adult, the most common risks for this group are going to be health problems, cardiovascular disease, cancer, cirrhosis of the liver, COPD are the biggest issues, especially. And then also their bones are losing density. Fractures are going to become more of an issue. Also fall risks. They could be higher. I think it depends on their health. Definitely for older adults, fall risk. But the bone density issue, especially for women, is something to be concerned about. Also, as this age group is aging, night vision is going to decrease. Driving at night is going to be more dangerous. But the good news for this group is that if they stay active and have good lifestyle habits, they can decrease the likelihood of a lot of major health issues, and they can really retain, bone density, muscle mass, all that really important stuff. And then lastly, the older adult, there are a variety of risk factors for this group. These include increased fall risk due to decreased proprioception and vision, hyper and hypotension, increased risk of respiratory infections, decreased tolerance to exercise, hypothermia or overheating due to the body's decreased ability to regulate body temperature, skin breakdown due to PVD, PAD, diabetes, anything like that. Because they do, also this age group takes a lot of medications, drug interactions and adverse drug reactions could also be a problem for this age group. Malnutrition due to the body's decreased ability to properly absorb nutrients is also an issue. And then lastly, the home environment, which is something that can be easily modified. That can also be a huge risk for this age group. That is my presentation.